We now discuss how impact is generated using a dynamical model as opposed to using a statistical model, as detailed in the video for IHT Statistical Impact Model. For more details of the dynamical model, refer to the presentation on IHT-TB's Dynamical Impact Model. Here we want to discuss the high-level design of the model as shown in the dynamical model presentation's model diagram. We see here the subset of the health states in the model and the transition between the states, for example, the infection process that controls the transition from being susceptible to having TB infection or having active TB disease. Arrows are used to show where interventions influence state transitions in the model. For example, the brown arrow influences the transition from being an active and prevalent TB case to being treated in the public or national TB program sector. Similarly, many transitions are influenced by interventions. To obtain impact using a dynamical model, we again configure the impact section of a projection using the dynamical model instead of using the statistical model. We'll come to this user choice shortly. For the moment, we want to show that the dynamical model uses more explicit impact mechanisms than the statistical model uses. Namely, the hazard ratio of detection maps to model parameters that determine the probability of being screened and detected, including early detection, and model parameters that determine the probability of being diagnosed, i.e., sensitivity of screening and diagnostic methods. The hazard ratio of prevention maps to TB regression and progression parameters in the dynamical model, and the hazard ratio of treatment outcomes maps to treatment success for first and second-line patients. Apart from the underlying differences in model structure, the approach to impact works the same way as for the statistical model. Hazard rates are prepared the same way, and impact results are viewed and analyzed the same way. When creating a new file, as shown in the IHT file creation video, the user can use the option of dynamical model as opposed to the statistical model, which is the default option. Statistical TB models are available in IHT for all countries, with the required WHO data for calibration. The calibration process for the dynamical model, however, is time-consuming, and as of 25th of April, in-house calibrations have been completed for 29 high-burden TB countries only. These models are currently calibrated to 2022 WHO data. We now look at the IHT interface for the dynamical model's static model parameters, meaning they have no time dependency. Parameters for the statistical impact model are more abstract and are not shown. Here, we show the parameters of the dynamical model for purposes of transparency. We don't expect non-technical users to edit these parameter sets as complex dependencies exist between them. The values are established during the calibration process, and they are loaded automatically for select countries during the projection creation process. The user can focus instead on the intervention structure, as presented in Section 3, Target Population section of the IHT dashboard, and configure a baseline and scale-up projection in order to study impact, as detailed in the Statistical Impact Model video. Once the target population and the impact ratio editors are correctly configured, the user needs to complete a few more steps before viewing results. First, the user sets the first and final years of intervention scale-up in the tab Impact Years, which are used as the interval of linear scale-up by the TB dynamical model. By default, these are set to the first and final year of the projection. As mentioned above, the user may review the model parameters that are established during calibration. Finally, the user triggers a calculation of the dynamical model via the Calculate button in the Calculate Dynamical Model tab. Note that this calculation does not trigger a calibration of the dynamical model. As mentioned, calibration of a dynamical model is a complex and time-consuming process, and it is not currently planned to do calibration directly from the IHT-TB interface. It triggers a forward projection instead between the first and final years of the projection as set by the user. We next look at the impact that is calculated for a prepared model. This example projection or scenario represents a simple scale-up strategy for a sample country, and its impact ratio editor has been configured following the approach we just outlined. Here, it is assumed that 2024 is first year of the scale-up strategy, and 2027 its final year of scale-up, and 2024 and 2027 are set as the first and final year of the scale-up in the Impact Years editor. Following the calculation outlined in the presentation on the statistical impact model, it can be shown that the hazard rates shown in the impact ratio editor imply an increase in 2027 of close to 50% in total notifications, an increase in size of 1.2% of the total population that is protected from TB disease, noting that we increases prevention in adult household contacts only, and a decrease of 37.5% in mortality from TB disease for those receiving treatment for TB disease. These relative changes are then mapped to parameters in the dynamical model associated with detection, prevention, and treatment of TB disease. After calculating the model, which applies the linear parameter scale-up pattern given by the impact ratios and the first and final year of impact, we see impact for the following three impact indicators: notification, incidence, and mortality, showing results for baseline, scale-up, and the difference between baseline and scale-up for each indicator. Note that TB prevalence is not shown here. Although it is estimated by the dynamical model, it is not reported in the WHO TB burden database and is not shown in IHT. Impact, as given by the bottom row, is the difference between the baseline and scale-up scenarios. For this example, new TB cases are reduced by 18% in 2027 and TB mortality by 33% in 2027 relative to the baseline projection. These impact estimates can be summarized and reported for different purposes in the National Strategic Plan preparation process. The dynamical model can also be used to study scenarios outside of IHT using MATLAB or Python scripts for the dynamical model. For example, the intervention elements outlined in the TB Global Plan can be added successively to a baseline scenario until all Global Plan interventions are added. The resulting impact in 2030 can then be compared to the impact target set out in the End TB strategy. The user can then return to IHT and map the Global Plan scenario to the target population component of IHT and use IHT to cost the full Global Plan scenario. The insights gained can be used to develop a national strategic plan, adapting the Global Plan to reflect a country's TB situation and budget. The following comments may help the user decide whether to use a statistical or dynamical impact model when creating a projection to study the cost and impact of a scenario. The statistical model works well without the burden of model calibration to produce reliable short-term impact estimates. The statistical model can, however, be pushed beyond its domain of reliable use. For example, pushing notifications too high for too long, leading to conditions where underlying assumptions of the statistical model no longer hold. The dynamical model carries a significant calibration burden to the extent that it is unlikely that someone unfamiliar with the model and its inner workings can produce reliable calibrations. However, it handles time dynamics better than the statistical model and, for example, will handle high notification targets better. It is expected to handle new interventions better, such as large-scale vaccination or earlier detection or detection of non-symptomatic TB, than the statistical model, which relies on past evidence for secondary impact on incidence. The dynamical TB model, which was developed in MATLAB and Python, is a more flexible scenario development tool than the statistical TB model, allowing modelers to develop more advanced scenarios before mapping a selected scenario to IHT for impact and costing analysis. There are many important aspects of target setting generally not considered by a general user that will lead to both models producing unreliable results. These include unrealistic notification targets being set, a lack of impact anticipation in notification target setting, leading to notification far exceeding projected incidence, and a lack of understanding guidance regarding the role of early detection and the average disease duration, which is a critical aspect of impact in dynamical models.